can strike without warning, and for my husband, it struck one summer morning. A tragedy to some degree, a death that would cause us effects for the coming days and months. Silently, it can attack anyone. It can attack without warning. It can plunge them into a darkness that can lead to a physical and an emotional death. What is this silent killer? It is PTSD. PTSD is post-traumatic stress syndrome. Silently, my family has been attacked for the past 2.5 years. Some days it presents itself full force, while other days the silence can be deafening. I began researching PTSD over the past 2.5 years when my husband was diagnosed. Today, I would like to introduce you to the brief overview of medications available for PTSD sufferers. The most traditional and widely utilized methods are medication, counseling, and military veteran partnering. The first medication that I would like to talk about today is antipsychotic drugs. These drugs are used to treat PTSD. Other drugs available are antidepressive and anti-anxiety drugs. Prazosin is also used. These medications are used to treat the sleep issues, emotional problems, and relieve anxiety and distress. These medications also can be used to treat, improve concentration, and to block chemicals that prohibit the brain from triggering PTSD. Certain side effects accompany these drugs and can include suicidal ideations, homicidal ideations, and further depression. These drugs can also exacerbate the original symptoms. Physicians tend to monitor PTSD sufferers. The second treatment therapy available is counseling. There are 3 types of counseling. The first type of counseling is cognitive therapy. This therapy uncovers the process that reveals false realities that can pose PTSD issues. The second therapy is exposure therapy. This is a behavioral therapy that reveals fears and causes resolution of PTSD issues. Restaging is used during this time. EMDR is eye movement desensitization and reprocessing. This particular therapy is used in conjunction with exposure therapy to process memories. Each of these therapies are utilized one with the other. The last treatment therapy available is military veteran partnering, or MVP. Through counseling and medications, this therapy can be very effective. The outcome can be very rewarding. According to the Department of Affairs, MVP and group therapy is very therapeutic in that it allows veterans the opportunity to relate to the PTSD sufferers. The benefits of MVP are there is no misconception, there's no judgment, and there are no questions, as is normal with the general population. New relations are also formed that correlate with other veterans who suffer from PTSD. Ultimately, MVP can be considered a safety zone for military personnel. Now that you have a brief overview of the traditional therapies, let's discuss a new evolving therapy, animal-assisted therapy, or AAT. Although relatively new, AAT is making remarkable strides among PTSD sufferers. According to the Elements of Behavioral, dogs are the preferred choice pet. However, other animals such as cats, birds, and even dolphins can be utilized. One benefit of animal-assisted therapy is the resolution of passing judgment. This is a common conception of PTSD sufferers among general population. With animal-assisted therapy, PTSD sufferers again have the freedom which they lost due to PTSD. Further benefits of animal-assisted therapy include the ability to have control, which was also lost. Regardless of a disability that a PTSD sufferer has, pets accept their owners and change with their owners. Pets also seem to have a sixth sense that can determine a PTSD attack. Virtually, there are no side effects with PTSD therapy. Today we have discussed the traditional therapies available to the PTSD sufferer, which include medications, counseling, and MVP therapy. Also, we have reviewed the new evolving therapy, animal-assisted therapy. Although relatively new, it has made remarkable strides versus traditional therapies. It has also been noted to be used in such a way that medications are less likely to be prescribed. The Department of Defense is contributing $300,000 to furthering the research to returning soldiers home that are diagnosed with PTSD. This research will be conducted at Walter Reed. This new exciting therapy can be shared with others who have PTSD. Why not share this therapy? What do they